It's a very exciting time in women's health and also obstetrics because there has been an explosion of available resources to help women prepare for labor and delivery. At Sanford Health, we offer online classes to meet families' needs to help them prepare for childbirth and lactation. We also provide a ton of real-time support at the bedside during the labor process and also the postpartum process to support parents as they transition to parenting and help with topics including nursing, breastfeeding, childcare, and also resources for when they discharge home from the hospital. And as members of your labor and delivery care team, we are all available to support you and your family as you make the transition home to care for your baby. There are many available online classes as well related to low intervention birth practices, including Lamaze, partner-led births, and hypnobirths. There are also classes within our community from some of our community partners that also help to prepare parents.
So through Sanford, we offer an online course in Bemidji where patients can do the class from home, and then have the opportunity to write down questions or concerns so that we can address those during their prenatal visits. We do also have a couple outside Sanford groups in Bemidji that do provide some prenatal care that are options as well. A patient support group can be actively involved during their prenatal care to be prepared and ready for the labor and delivery process, whether that's just going through the classes or attending prenatal appointments. During the actual labor and delivery experience, we anticipate and hope that they'll be active in supporting the laboring mom with the assistance of our nurses and our other staff within the labor and delivery unit. There's a couple signs of what patients should be watching for when they should come to the hospital or call. And really anytime they have concerns or are unsure, we're always there and open and available for questions or concerns. For contractions, we use a 5-1-1 rule. So that means timing contractions from the start of one contraction to the start of next contraction. Once contractions are approximately every 5 minutes, they last 1 minute, and that's ongoing for 1 hour is when we would recommend coming into the hospital. Other concerns would be not feeling their baby move adequately or that their water could have broke. So pain management during labor, we have both medication and non-medication options. From a non-medication standpoint, options would include things like being up and moving or ambulating, being in the shower or the tub, different birthing positions, using birthing balls or labor positioning balls, rocking chairs. From a medication standpoint, our 3 main pain management options would include IV pain medications, nitrous oxide or an inhaled laughing gas, and an epidural. For postpartum care with a vaginal delivery, most patients' pain will be managed with ibuprofen and Tylenol, as well as other things as far as laceration repairs that can be used topically. At Sanford and Bemidji, we support both vaginal deliveries and cesarean sections, depending on kind of the role and indication of why patients need to be delivered or how they're going to be delivered. The recovery and process, obviously, of each is different, and sometimes our plan is to try for a vaginal delivery and patients need a C-section for different indications. A vaginal birth after cesarean section is someone who's had a previous cesarean section and now their goal is trying for a vaginal delivery. Operative deliveries can be an option depending on the indication. They're not something that we do frequently because they do have risks with them, but there can be indications such as a baby who may be needing to be delivery expedited. There would be a discussion between the patient and the provider before that option is done so that a patient has the opportunity to ask questions and to consent to the procedure. Prenatal care allows us to prepare and be ready for labor, but one of those aspects is how is the patient going to get to the hospital? Having a plan in place of who's going to drive you or how you're going to get to the hospital is important, and always knowing that calling 911 would be an option if a patient didn't have access to transportation. Although our labor and delivery unit is always open and accessible to all patients, it does help us to be prepared when patients are coming in. So notifying our labor and delivery unit ahead of time is helpful, but not an absolute necessity. Our nurses can also help answer questions over the phone if a patient is trying to decide whether or not it's time for them to come in. Although our goal is always to have a term delivery, there is time when labor happens prior to us anticipating it. Knowing the signs of labor and paying attention to those to be able to come into the hospital if patients have concerns is important. Our labor and delivery unit is there to help patients navigate those decisions by calling ahead so that we can answer any questions and then having them come in so we can give them appropriate care. We know that some patients, based on their personal preference, will have cultural beliefs that they would like to do or be able to perform during their labor and delivery process. We're very open to those options and appreciate the time during their prenatal care to discuss with them and make sure that we're able to and have the resources available for them during that process.